Hello, I'm Kerry Walsh, and today we are bringing you a product that can literally save your life. One of the leading causes of death in our country is patient misdiagnosis and mistreatment due to the lack of immediate and accurate medical information. We're bringing you a digital medical card that will give you that accurate and immediate information in any situation that could mean life or death. I'm with the country's leading insurance specialist, Grady Ford of Ford Consulting Group, Nicholas Castellano of Castle Benefits Consulting Group, and Dr. Smith, one of the country's leading foot doctors and creator and owner of MyBadFeet.com. Thank you so much for being with us. And Dr. Smith, I'll start with you. How important is this card?
Well, one of the surprising statistics that most people probably don't even know about is misinformation is the third leading cause of death in this country next to heart disease and cancer.
As a matter of fact, just to follow up on that, on our side, the employers are asking us, how can we cut costs? And medical errors cost our clients $29 billion annually and account for 100,000 deaths.
That's unbelievable. What exactly is it and how does it do the work?
Well, it's a digital card that is the size of a credit card, the size of a business card. And this card is very easy to access. You put a cord in on the side, USB port into your computer, and all of a sudden you download the information by going to Google Health. You can access this anywhere you are in the United States, literally anywhere you are in the world.
Who inputs this information?
You do.
Well, actually, that's the beauty of it. In our world, everything must be HIPAA compliant. The patient or the consumer controls what information actually goes on the card and what is uploaded into Google Health.
And you don't need a computer, you don't need a screen to access this information?
Now, this is the only device that does not require a chip reader, a computer, or anything else to access the information. And in times, and doctor, I'm sure you will agree with this, in an emergency situation, an EMT person comes in, they'll have a card right on their windshield that would show that they have this card. They immediately go to that, they gather that information. They don't have to go back into the ambulance. They can pull that information, push the button, and automatically they have everything they need.
So Dr. Smith, how important is this card and the information that it contains for you working with patients?
Well, it's extremely important. When you talk in terms like Nick mentioned, emergency situation. I'm not an emergency specialist, I'm a foot specialist, but still I know that seconds matter in situations like that. Coming from a private practice standpoint, I mean, having that pertinent, accurate information before you're going to take somebody to surgery is extremely important. And there are drug interactions that can be life-threatening if you do not know exactly what's going on with a patient. And sometimes a patient doesn't know it's important. But if you have that information on a device as simple as this, where it's easy to use, and it's attached to Google Health, which we all know how big and important Google is, it's just really, really important. And as you said in the beginning, that this device could truly save your life, even from a specialist or an emergency specialist or any type of doctor.
So from my point of view, God forbid I have a drug that I'm taking for another medical reason that interacts with something that you might have prescribed, but also for you, instead of me bringing you my whole bag of medicines, which could be in quantity, this helps you.
Absolutely. A lot of doctors discontinue medications, and some people they kind of keep the bag, but they don't know exactly what they're taking. And that's hugely important, especially when I have elderly patients. I have patients that come in with their sons and daughters, and honestly, a lot of times they don't know exactly what's going on. And this card's imperative for something like that and can truly save a life.
And as we're going to see on the video in a little while, I put in the information. So if there are vitamins I'm taking that a doctor hasn't prescribed, that will also be on there.
That's a perfect example. The doctor prescribed for one of my family members a baby aspirin. While that's not a prescription med, and I'm no medical professional, but I know if someone's taking Coumadin, they're taking a baby aspirin, it has an impact. So that's critical that all the information, no matter how small, insignificant as a non-professional I may think it is, the doctor may see that as critical.
And it's custom to me personally as the patient.
That's correct.
And how about, we have parents and children that we can't always be with, or that maybe we don't know all of the things that they're involved with. This would be obviously a benefit there.
Absolutely. For a father with children in college, just knowing that they have this information, if something were to happen to them, they will know the emergency contact, they will know who the physicians are that have treated my son, they will know what medicine everything that I can put onto that card, they will have instantaneously in their hands.
And we have parents we care for that we can't always be with.
Oh, absolutely, Carrie. I'm actually responsible for my mother's care. And the first question that I'm asked when I take her to a specialist is, what prescription drugs does she take? And more importantly, ask, what's her family history? And I'm sorry, but I don't know my grandparents' medical history, but according to the doctors, that's vital.
And you had mentioned how much money it can save to the insurance companies by not performing unnecessary tests. But Dr. Smith, to you, why not do all the tests that we possibly can? Why not make sure everything's good?
Well, scary word for you, radiation. You have a lot of doctors who prescribe a lot of tests. They're always concerned about being sued. And that's a very, very important thing, especially in reference to this card, because what it does, it stops doctors from over-testing. If you just had x-rays, 6 months ago, for certain situations, those x-rays aren't going to change in 6 months. But a lot of times doctors don't interact or don't communicate properly, or hospitals to doctors or hospitals to hospitals don't communicate. And what happens is you end up getting these over-testing and getting exposed to the types of things you don't want to be exposed to, MRIs, CT scans, things of that nature. That if we just had a device as simple as this, and especially with the use of Google Health, what makes it simple to access this material for your doctor and your family, it's huge.
And Nicholas, I know you have been in the insurance industry for some time now. Are there sometimes instances where the records aren't completely updated immediately?
Well, the records aren't updated immediately, number one, and number two, in a most recent study that came through, they state that $271 per employee is saved by not having to have duplication.
So not only can this product save your life, it can save you money. So make sure you call that number on the screen right now. It's toll free. We have someone available to speak with you 24 hours a day, 7 days a week, to answer any and all of your questions. And make sure you order this card today.
Sometimes a matter of minutes could mean the difference between life and death. Having accurate medical information close at hand can give you those precious minutes. Hi, I'm Heather Thompson, here to guide you through the benefits of having the new patented personal medical information card with its built-in LCD screen. Your personal medical information card can hold your entire medical history, but it's small, about the size of a credit card, so you can keep it with you at all times. In an emergency, doctors, nurses, EMTs, police, and fire department personnel need your medical history as fast as possible so they can give you the best possible treatment. If the wrong treatment is given, the consequences could mean the difference between life and death. Using a secure, private web profile, you continually update your own medical history. Because it's a web-based application, this can be done from any computer in the world, as long as it has an internet connection. You and your doctor choose what information is downloaded from your secure web profile to your card, so you have complete discretion over potentially sensitive medical information. You start by inputting your personal contact information, such as name, address, phone number, birth date, blood type, insurance provider, and policy number. You can even upload a current picture. Next, enter your critical medical information, such as any food or drug allergies or conditions you might have, like diabetes or hypertension. You follow that with prescription drug information, including the names of the drugs, the dosages, and the frequency. You can include any major surgeries, the surgeon's name, the location, and the date of the operation. If you have any pertinent social or family history, there's also room for that, such as alcohol or tobacco use, or a family history of lymphoma or heart disease. Finally, you can enter emergency contact information, both family members and any specialist doctors you might see on a regular basis. After each update to your web profile, you simply plug your card into the computer with the supplied USB cable to transfer your information to the card. It's as easy as that. As you can see, all of the information you entered into your completely secure online medical profile is now right at the fingertips of emergency medical personnel. Here's your personal information and your critical medical information, your ongoing medical conditions, prescription drug information, surgical information, family and social history, and emergency contact information. In the event of an emergency, medical technicians need accurate information about your medical history and medications. Whether it's because the patient is unconscious, incoherent, or simply doesn't know their critical information, the electronic personal medical information card speaks for them, accurately and immediately. The electronic personal medical information card is an affordable way to get peace of mind, knowing that in an emergency, caregivers and medical teams will have immediate access to accurate medical data that could save your life or the life of your loved ones.
We're talking about a product today that could literally save your life. It's an electronic medical records card. And Dr. Smith, tell us basically again, what can it do for you? What are the benefits?
Well, Carrie, this is a digital age, and everything we do is digital, including lab reports, and we all know how those are extremely important. Most people get a lab drawn or blood drawn today and won't know anything about those labs 6 months from now. So what this device does, allows you to keep and maintain those records on Google Health. Also keep in mind, everything is digitized, x-rays, MRIs. And what that does is it keeps it in one specific place. If you ask anybody in your family if they had an MRI a couple years ago, where is that report? What did it show? Most people have no idea, and that's why this card is so important, because it allows you for the rest of your life to have all that information accurately, and it's digitized, so it doesn't go anywhere.
And Grady, being in the insurance industry for over 30 years, you know, they don't always share that information.
Oh, absolutely not. They absolutely don't share that information. But you know what? More importantly, the insurance industry has evolved over years. Years ago, your doctor was your doctor for life. Today, with networks changing and managed care, my wife may have 3 different doctors. I may have 4 different doctors. This card is critical because now, as networks change, as my employer changes carriers, I can now take my medical history from one doctor to the next doctor.
And Nick, will this help you in dealing with your insurance agencies
Well,
too?
it does, because oftentimes we're trying to, consumer-driven healthcare is the big thing, and we're trying to educate consumers to try to find their drugs anywhere they can that's cheap. So sometimes they're getting them at a grocery type of chain. Sometimes they're going to the drugstore. Sometimes it's mail order. They're coming from all different areas, and unfortunately, there's not one database that holds it all. So when they go to the pharmacist, he says, yes, take this. And we don't know the drug interaction. And doctor, you can attest to that as to how serious that's life-threatening.
Does that happen often? Do you have situations where patients don't know?
Extremely. Well, a patient will tell me a list of medications, but don't necessarily give me an accurate list. And I'll write a prescription, whether it's pre-op, post-op, or just for whatever issue we're dealing with. And they'll say, oh no, doc, I'm allergic to that. And you know, I don't know unless they tell me. So to have a device like this, they can simply give it to me. I can hand it to my staff. They can download it, and I can print all their information. Therefore, there's no more questions. I mean, you're talking 1.5 million people a year can die from medical misinformation, a statistic result.
We say this card speaks for us when we can't speak for ourselves. In crisis situation, it's going to be important for them to know the meds that you're giving them and other doctors are giving them.
Absolutely. If you're incapacitated, if you have, let's say, for example, a seizure episode, you can't tell people exactly what's going on. And we have stickers with the card that you can put on your car, a little card that you can put in your wallet, that once they know that you have this device, they can go into your wallet, they can actually bring it up, and they can have all that information right there, readily available, and seconds matter.
And Grady, tell me again, there is security in this. It is electronic and it is immediately accessible, but it's what you choose to put on there.
That's correct. Not only is what you choose to put on it, but under Google Health, everything is password protected. In order to change the data on here, you must log in and sign in with your password, and then that data is updated. You know what's more important, the reason we were so excited about this product is there are other products out there in the marketplace, but you don't have to plug this product or get into a computer. You have immediate access to this product. So if an EMT arrives on the scene, he can immediately look at the screen and see what your allergies are, see what your blood type is, see what medications you're taking, and who's the emergency contact that they should be calling in the event of an emergency.
And we're going to see a video that will take you through all the steps of how easy this product is to use. But call that number on the screen, and we have someone available 24 hours a day, 7 days a week to help you with any questions that you have. But it is imperative, and it definitely is a life or death situation in having one of these cards on your possession in the event of emergency. And on that note, to have this on you, it can be anywhere. So if we're traveling, Nick?
You could be on a cruise ship. You don't have to worry about satellites. You don't have to worry about doing anything in advance. You're going to Europe, you're going to any island, anywhere you are, you just push the button and it's all right there for you.
So Nick was describing about how you travel, this will be accessible. How about, is it interpreted in different languages?
Absolutely. That's another unique attribute in reference to this device, is that you can actually have your information in different languages. Spanish being the second most spoken language in the United States, you can actually download your information in Spanish, and that's huge.
So whether traveling or maybe a language barrier, or perhaps, Grady, I'm in the emergency room and I just am panicking and have my mind goes blank. These situations happen.
You know what, that's a perfect example. You know what, not only does your mind go blank, if I'm the person accompanying that person, my mind goes blank. Blood type, a simple question is, what type of blood does your child have? What type of blood does your spouse have? You know what, in a moment of urgency, sometimes you just don't remember.
And yet that is so important to know something as basic as your blood
Absolutely.
type.
I know we continue to reiterate it, but what if you don't have anybody with you? I mean, that's key. If you have no one with you, who's going to answer those pertinent questions, especially if it's something serious where you can't speak for yourself?
And generally an emergency occurs and
Yes.
you are alone.
You are alone.
This is a product that literally will save your life. And I don't think that there's a price tag that you can place on that. And just for a little more than $10 a month, which is not asking much for your safety, you can have the peace of mind of knowing that in an emergency situation, you will get the proper, accurate, and immediate medical attention. This is something that will speak for you when you can't speak for yourself. Make sure you call that number on the screen right now. And for our first 1,000 callers, we'll give you a complimentary carrying case for your digital card to hold all of your information that may be the difference between life and death.
Sometimes a matter of minutes could mean the difference between life and death. Having accurate medical information close at hand can give you those precious minutes. Hi, I'm Heather Thompson, here to guide you through the benefits of having the new patented personal medical information card with its built-in LCD screen. Your personal medical information card can hold your entire medical history, but it's small, about the size of a credit card, so you can keep it with you at all times. In an emergency, doctors, nurses, EMTs, police, and fire department personnel need your medical history as fast as possible so they can give you the best possible treatment. If the wrong treatment is given, the consequences could mean the difference between life and death. Using a secure, private web profile, you continually update your own medical history. Because it's a web-based application, this can be done from any computer in the world, as long as it has an internet connection. You and your doctor choose what information is downloaded from your secure web profile to your card, so you have complete discretion over potentially sensitive medical information. You start by inputting your personal contact information, such as name, address, phone number, birth date, blood type, insurance provider, and policy number. You can even upload a current picture. Next, enter your critical medical information, such as any food or drug allergies or conditions you might have, like diabetes or hypertension. You follow that with prescription drug information, including the names of the drugs, the dosages, and the frequency. You can include any major surgeries, the surgeon's name, the location, and the date of the operation. If you have any pertinent social or family history, there's also room for that, such as alcohol or tobacco use, or a family history of lymphoma or heart disease. Finally, you can enter emergency contact information, both family members and any specialist doctors you might see on a regular basis. After each update to your web profile, you simply plug your card into the computer with the supplied USB cable to transfer your information to the card. It's as easy as that. As you can see, all of the information you entered into your completely secure online medical profile is now right at the fingertips of emergency medical personnel. Here's your personal information and your critical medical information, your ongoing medical conditions, prescription drug information, surgical information, family and social history, and emergency contact information. In the event of an emergency, medical technicians need accurate information about your medical history and medications. Whether it's because the patient is unconscious, incoherent, or simply doesn't know their critical information, the electronic personal medical information card speaks for them, accurately and immediately. The electronic personal medical information card is an affordable way to get peace of mind, knowing that in an emergency, caregivers and medical teams will have immediate access to accurate medical data that could save your life or the life of your loved ones.
We're back and we're talking about a product that literally could save your life, to give you peace of mind, to have the information available in an emergency situation that they need, the healthcare professionals, to give you the appropriate care that you need. And I'm holding the device, and as you can see, one of the screens has an actual CT scan, so that in the event that you're incoherent or not able to speak to the professional, they can go through the records that you've downloaded and give you the appropriate care. And Nicholas, tell me exactly how this operates. Is it a battery, and how long does it run?
Sure, it's a battery operation. It will last up to 4 months, and all it is every time you plug this in to the side and into your computer, it recharges it. And you don't have to replace any batteries, you don't have to do anything like that. And we just recommend that if you're going away, make sure you recharge it just so you know that it's there. But just anytime you're going to work on your computer, just take it out of your wallet and stick it in there. It takes 2 seconds.
And Dr. Smith, we had spoken about how one of the leading causes of death is not having the accurate information available to those medical professionals that need it.
Absolutely. It's a sad statistic. I mean, you can see I'm sitting here playing with it now. I enjoy this device because it has so much pertinent information. Even the CT scan that you looked at, I mean, look at the detail of that. I mean, it's 1 gigabyte of memory, and I'm not sure the megapixels of this screen, but it's extremely detailed. And it just allows the physician to be able to flow through, see emergency contacts, allow to see allergies, allow to see medications from years past. So we actually know everything that's going on with this patient and don't have to ask 1,000,001 questions and sometimes get the wrong answer. We don't want that.
You know, if someone comes into your practice, you're a renowned foot doctor in the area, and they haven't told you all of the prescriptions they're taking, it could be devastating.
Oh, absolutely. Being a surgical specialist, I had an experience where I had a patient who didn't think it was important to tell me he took aspirin. And everybody out there knows that's important to let me know. And we had some issues in the operating room. Everything came out perfectly okay, but it was still a bit of information that we needed to know. So everything worked well. But had he had one of these, then I would have seen that he was taking aspirin.
And Grady, we were speaking about how with your mother, even if you're going to the doctors with her and you need to know her medical information, or you can't go with her and there's something she missed, this could be devastating to your family.
Oh, absolutely. It's critical. And not just for my mother, but also for spouses, for children. It's important. We don't always remember all the information we need. Unless a doctor asks, we may not realize that a small, minor detail is very important.